As you say, we were able to come together as Minnesotans and as a chamber to prove to the people of this state that we can work in a bipartisan fashion to accomplish good things during this fraught and partisan time. I'm going to take an opportunity to speak about another great accomplishment that Minnesotans can be proud of in that same vein today, Mr. President, and that is the improvement in hospitalizations for COVID-19. And as I was walking out of the chamber after the last vote, Senator Gazelka pointed out to me that, I had spoken on the floor fairly passionately about the risk to our hospitals about 6 weeks ago. And without question, the month of June has been a continuous decline in hospitalizations and ICU stays for people with COVID-19 in Minnesota. It's a tremendous accomplishment. We can feel it in our practice. Every staff person can feel it, and we feel that we're able to deliver better care. And being a legislature and being a political body, people will then say, well, who gets credit for that, or who gets blamed, or did we do it wrong that we're in the place we are in? And I would argue that we all get credit for it. We worked well together as Minnesotans. Certainly Governor Walz, with his austere leadership and patient steerage of this ship, gets credit. But above all, Mr. President, the people of Minnesota, through shared sacrifice, get the credit for this incredible turn of events. If you look at the state of Texas, their graph for June is the opposite of ours. It is a continual positive slope in hospitalization and intensive care unit stays after they ended their stay-at-home order on April 30th. They are desperately short on supplies. Their staff is overworked and fraught, and difficult decisions, such as I alluded to previously, are being made. So we have much to be grateful for in Minnesota, that the good people of Minnesota sacrificed collectively. And I know that everyone sacrificed, some with tremendous hardship and tremendous loss, some to the point that they may not recover to their previous level of economic prosperity or health. But we did it to get to this point, Mr. President. We did it to get to this point where we can manage COVID-19 for the time being in our hospitals. We can care for people appropriately and treat Minnesotans the way we anticipate we should be able to treat them. Epidemiologists tell us, Mr. President, that we will have a second wave. I trust them because they know their work. But now we know that when that comes, that we have the diligence and the intelligence and the durability in this state to approach it correctly. So I thank Governor Walz for steering this ship appropriately, and I thank the people of Minnesota for working in a bipartisan fashion.